Hi everyone, how you doing? Today, let's talk about the three phases that most of my patients will go through in order to get a fantastic looking smile. So my name's Gus, I'm a cosmetic and implant dentist based near London in the UK, and all of my patients who need a full mouth of care go through kind of three phases of treatment, okay? And the all-on-4 people are slightly different. Okay, so all-on-4 is when we replace everything with dental implants and there's no natural teeth left. But the majority of patients who I see actually have a good number of their own teeth. So we try and keep those and rebuild around those. Now, if you're thinking about this kind of treatment, I want to kind of just outline the three phases that we go through in order to predictably create really nice looking but long-lasting smiles. And the first stage is not part of this process. The first part of anything complicated like this is to plan it. Okay, so we sit down with the patient, we visualize what we want the end result to look like, and we'll discuss things which are going to complicate, compromises which we're going to have to make because of the situation that the patient is in. Once we know all of that, the first thing that we need to do is get to 100% health. Okay, and this means zero gum disease and it means zero tooth decay. Okay, tooth decay and gum disease are the two most common problems that people have with their teeth inside their mouth. So we need to get to a level where we've got none of these problems. Now, sometimes teeth are very badly affected with gum disease or tooth decay. So in those situations, we remove those teeth. So we get rid of the worst ones. We decide what we're going to keep, and then we get rid of all the gum disease. Sometimes this might mean seeing a specialist for the gums, and we get rid of any tooth decay, even if we're just cleaning it out and putting in temporary fillings for the moment. Okay, that's the first thing that we need to do. We have to always start a rebuild project with perfect health. Next is the foundation. So this is phase 2, is the kind of the foundation work. And what this means is where we've had areas of gum disease and we're thinking to have dental implants, sometimes we might need to increase the bone. So we might need to do bone grafting or tissue grafting and stuff like that. So there's two phases to the foundation work, okay? And ultimately, we want to get to a stage where the implants are in. So implants are a way of replacing missing teeth. It's kind of like a false root. You can put an implant in and you can connect it to a single tooth. You can have 2 implants and make a bridge. You can have 4 to 6 implants and have a whole smile sitting on that, okay? So we need to plan where the implants are going to go, which is dictated by what the teeth are going to look like at the end. And we need to make sure there's enough bone there so that we've got bone encasing all of these implants so that these implants last for as long as possible. Okay, so the two phases here are rebuild the bone, okay, and place our dental implants. If we're doing this in 2 separate surgeries, which sometimes we need to do, this foundation stage can take anywhere from 6 to 9 months. Okay, it's not a quick process, and it's really frustrating because a lot of our patients will, they're ready to go ahead. In their head, they've got this vision of what the end smile is going to look like, but we have to wait all of this healing time for the foundation work to basically set. Okay, and during this time, we do try and give our patients really good-looking temporary teeth. We want, even at these early stages, we want the temporaries to look really nice so that at least when the patient looks in the mirror, they almost see something, they see an improvement, because this foundation work is completely below the gum. You don't see anything. Once the foundation is done, it becomes very easy, because now we start with the kind of the painting and decorating. We want to make it look nice, and here we will make temporary teeth on the natural teeth which we're keeping, temporary veneers, crowns, whatever it is, and also temporary teeth on the implants. And this helps us judge what the bite is going to be like, and it also helps us judge the aesthetics. Are the teeth, what length do we want the teeth? So the aesthetics of the smile in terms of the length of the top teeth is really important. When people have teeth which are too long or too bulky or too big, it starts looking really fake. So we want to get all this kind of stuff sorted out in our temporary materials. And we make our temporaries kind of freehand. It takes a couple of hours to do it, but we find this is the most reliable way to get a good set of temporary teeth made. Once both the patient and I are happy with the look of the temporaries and there's no breakages, or if there's breakages, we've addressed why the breakages happen and we've corrected the bite in that area, then we can proceed to making our final set. Okay, and quite often I'll do this, we'll fit the bottom ones first and then we'll fit the top ones. Rarely I do everything all at once, but that's it, right? That's phase 3. It's really a simple, logical way of going through treatment. And I think most people who are experienced in doing full mouth care like this will have the same approach. So no matter who you see in whatever country, as long as you're going to see a reputable clinician who's done this a lot of times, then you should be going through these 3 phases. Now, there are shortcuts to this as well. So let's take an extremely popular treatment like all on 4, which is where we take out all the bad teeth, we put implants in all on the same day and make a set of temporary teeth all on the same day. Okay, so in this case, what we're doing is we're getting to perfect health by physically removing the disease. We cut away the diseased gum, we remove the diseased teeth. Okay, so that's our shortcut there. Then we're putting our implants in the same surgery, and we're making a set of temporary teeth, which is going to go some way into phase 3, which is the kind of the painting and decorating phase. Okay, I think that's why this treatment is so popular, because there's very little kind of downtime. You get results really early on, and you can go through this whole phase without having to see a periodontist, without having so much treatment. And unfortunately, I think it's kind of overprescribed, because sometimes a better thing is to keep the healthy teeth. But I've made videos about that in the past, and the regular viewers here will kind of know where I stand on this kind of stuff, because keeping your own teeth has a lot of advantages. So if we're taking a kind of a bird's eye view of overall treatment plans, it's very similar to building a house, where you plan it, you do the foundations, and then you build the house, and it's right at the end do you actually see what you've been waiting for. It's a long process, like building a house is, and if you do it in a logical fashion like this, and you don't try and cut too many corners, you're going to end up with the best long-term results. So as always, guys, I hope you found this video useful. I hope you found it informative. If you've got questions, comments, leave them below, and I will try and respond to the ones I see. I don't actually get notifications for all of them. Okay, all right, guys, until next time, take care.